Hello, is it okay to come in? Alright. Hello, so my name's Subin. I'm going to be your nurse today. So I have an order from Dr. Masters to do a postpartum assessment on you. Is that alright? Alright, so can I just get your name and date of birth real quick? Alright, Miss Kelly Addison. Yep. 7/12/1974. Alright, awesome. Let me just wash my hands, put my gloves on. Alright. I'm just going to close the curtain for privacy reasons. Alright. And I'm just going to compare my order number with your wristband. Alright, so Kelly Addison, 7/12/1974, GAL 225346. Alright, cool. Alright, so Miss Addison, is there any allergies that I should be aware of? No, nothing to medication, no food allergies. Alright, cool. So I want to note that when I walked into the room, the mother was holding the child, interacting, smiling, talking with the child. Yeah, interacting with the child, smiling. She was showing no signs of postpartum depression. There's no facial drooping. There's no slurred speech. Alright, okay. So the first couple questions. Do you feel any sort of headache that's not relieved by medication? No. Any visual disturbances? No. Okay, cool. And lastly, do you feel any upper right abdominal pain? No. No big gastric pain? Alright, cool. So we got that out of the way. So next I'm going to be checking your breast, okay? Is that alright? Alright, cool. So I'm just going to expose your breast, nothing else. Alright, so upon looking at the breast, I don't see any sort of redness. I don't see any sort of signs of engorgement. Alright, so now I'm going to palpate just like in your monthly breast exam. Do you feel any tenderness as I palpate? No? Alright, I don't feel any sort of heat, so it looks like we're good. Looking at the nipple, it's not cracked or bleeding, which is good. Alright. So just remember to wear a 24-hour supportive bra. Take it off only for showers. Let the breast milk air dry when feeding your child. And yeah, it just helps with the latching. Wear breast pads inside your bra. This just in case you accidentally lactate. Alright. Have you talked to a lactation specialist? Alright, cool. So you've decided to breastfeed or? Alright, cool. That's good. Alright. Next, we're going to check in your abdominal area, alright? So I'm going to reveal you again, or expose you again a little bit. Keep everything else covered. And keep the perineum covered. Alright, so looking at the abdomen area. It's just stretched a little bit, which is normal for postpartum. I don't see any sort of redness, no bulges, no masses of any sort. Alright. Alright, so I'm going to take a quick listen real quick. Alright, so starting from the lower left, upper right, lower right. Alright, I'm going to listen to each section for 1 full minute. Don't hear any, just hear normal active bowel sounds, no hyperactive, no hypoactive. Alright. Next, I'm going to check on your uterus. So I'm going to check for the fundus of the uterus. To do this, I'm going to support with my left hand the suprapubic area. And I'm going to use my right hand to slowly palpate, just starting from the upper umbilicus. Palpate down. Alright, so feel some firmness right here. It's about 1 centimeter from the umbilicus. It's firm in midline, so it's right where it should be, alright? That's good. Alright, just going to cover you back up and then ask you a couple other questions. Alright, so when's the last time you had a bowel movement? Alright, this morning. So was the color, was it anything abnormal, like green or black? Normal brown color? Alright. Was there any abnormal odor? No, just a normal, yeah, okay. Consistency, was it watery or soft formed? Alright, soft and formed, okay. In your mouth, was it a lot, was it a little? Alright, so just the usual type. Nothing too much, no too little. Alright, cool. Alright, and then same thing with urine. When's the last time you urinated? Alright, this morning. So what was the color? Okay, clear yellow. Cool. Was there any weird odor with it? No. And was it the normal amount or a little more? Or was it a little more? Okay. So that's normal for pregnancy, you know. Alright. So that's normal for postpartum. And yeah. Alright. So next I'm going to be checking just on your pad real quick. Alright, so I'm going to pull down your underwear. Alright. So looking at your pad, I just see normal rubia lochia. It's a 2 centimeter clot. It's a little red. There's a bit. Alright. So I'm going to keep it down. Since I got dirty gloves now, I'm going to take them off. Wash my hands again. Put new ones on. So what I'm going to have you do next is roll over to your side. I'm going to check your back area, so I should perineum area, make sure that it's all healing well, alright? These gloves, I tell you. Alright, so I'm going to turn you to the side. I'm going to help you raise your leg up. So I'm taking a look. So I don't see no hemorrhoids, hemorrhoids or hematoma. So it is a left medial lateral 2nd degree episiotomy. It looks like the edges are well approximated. Looks like it's healing well. Alright. And while I'm here, just going to put your leg down, but I still need to look at your back. I'm going to check the epidural site. Don't see any sort of redness. No drainage, no leakage. Alright, so it's looking good. Alright, so you can come back down, help you pull up your underwear. Alrighty. Next, checking out your legs, alright? So, upon looking at your legs, don't see any sort of edema. Or I see a little bit of edema, but not too much. This is normal for postpartum, prepartum, antepartum. Alright, I'm going to check your popliteal pulse. 1 good minute. Alright, 2 plus and regular. Very nice. Alright, I'm going to feel down your calf. I'm looking for signs of DVT, so I don't feel any sort of heat. No lumps or bumps. Yep. Alright. Doesn't look like there's any sort of swelling anywhere. Doesn't look red to me. Nope. Alright. Alright, so now on your legs, I'm going to take your pedal pulses. Dorsal pedals. And they're 2 plus and regular for 1 good minute. Yeah, 2 plus and regular. Checking your cap refill, less than 3 seconds. And do you feel it when I touch your legs? Both of them? Alright, cool. Alright, so that's it for my postpartum assessment. Next, I just got some educational stuff for you. Alright, so let's start with the stuff for you first. Alright. So nutrition wise, eat like 500 extra calories a day. Try to drink 8 to 12 cups of water. Alright. Sorry. So in the beginning, when I told you about those headaches that can be relieved with medication, visual disturbances, or any sort of upper right abdominal pain, let your provider know. This is signs for preeclampsia, postpartum preeclampsia. So you want to look out for that. For your breast, like I said, wear that supportive bra 24 hours a day, except in the shower. Wear those breast pads inside your bra, so just in case you're accidental lactation. The breast milk, make sure to keep it air dry it. When you wash your nipples, don't just use water, no soap. Alright. Look out for any cracking or bleeding in the nipples. Alright, and remember to do your monthly breast exams, so in a circular motion. Alright, cool. Alright. So pain. If you're feeling any sort of pain, I'd just recommend cyst baths, topical ointment. So if there's like sprays or that you can put on the affected area, or NSAIDs such as ibuprofen, Tylenol, acetaminophen of any kind. Alright. Alright, so peri area. So that little bit of discharge that you have on your pad, that's going to be normal. Just try to change it out as often as you see it. When you're changing out the pad, make sure you have clean hands before and after. Wash your hands. Alright. Try to so it's going to be a little bit painful because of that episiotomy that you have. So you might want to use a peri bottle. Remember, wash front to back. So with the peri bottle, just use warm water, no soap involved. Alright. Yeah, and the Logia rubia, rubia logia, should decrease with the amount, and it should become less red, like red color, should be becoming clear. If you notice otherwise, like if it becomes a lot or if it becomes redder, like a dark red, just let your provider know. Alright. Cool. Yeah, and I think that's it. Yep. Alright, so next we're going to be talking about your child. So for your child, you want to make sure to look for any sort of temperature change. So if their temperature goes up to 100.4 or higher, let your provider know. You can take the temperature with auxiliary. Make sure they have 6 to 8 wet diapers. If they have less than that, call your provider. If they have any forceful vomiting or diarrhea, call your provider. So for sleeping, make sure they're on a firm mattress, tight fitted sheets. Lay them on their back. Do not put anything else in the crib. No pillows, no blankets, no toys. Dress them up according to the weather. If it's hot, lightweight clothes. If it's cold, make sure to put some, like swaddle them up with sweaters and blankets and stuff. Or not blankets, but dress them up warmly. Cover up their heads. Yeah. Bulb syringe. So you're going to be using this to suck out secretions out of an infant's mouth. So the way to use this is to depress it, put it into one cheek, let go. It should suck out the secretions. Put the secretions into a tissue. Do the same thing on the other cheek. Depress, suck out. And then when you're using it on the nose, make sure to just put the tip in. Don't put it all the way in, or else their airway is obstructed. So just squeeze, suck out a little bit, as much as you can. Put it into a tissue. When using these, try to clean with warm soapy water. Warm soapy water, and change it as often as you can. Alright. When you take your child, they're going to be going in the car seat, right? So with the car seat, make sure it's rear facing until they reach the maximum height and weight, which you can find on the car seat. It should be around 2 years old. Alright. Then you can turn it around. To the car seat. Weather-wise, clothing-wise, dress them up according to the weather. If it's cold, dress them up. If it's hot, just use lightweight clothes. Alright. Avoid using sunscreen unless it's prescribed by your provider. They'll tell you which ones to use and which one not to. And try to just keep them in the shade as much as possible. Alright. Other thing, birth control. So for birth control, so try to abstain from any sexual activities for 6 weeks. If you feel like otherwise, talk to your provider about a contraceptive, because with the breast milk, now that you're giving your infant breast milk, you don't want the hormones to be imbalanced. So talk to your provider about that. Alright. Alrighty, cool. talked about that. Talked about this. Just make sure. I think, oh, cord care. So for the infant, they're gonna have this little cord. It's gonna be clamped up. It will change color from yellow to green to black. Make sure to just keep it dry, keep it clean, away from infection. When you're putting on the diaper, fold the diaper underneath the cord so it doesn't get any urine or feces on it, it gets infected. But yeah, it should fall out within 7 to 10 days by itself. You might find it in your bed or just in the diaper, either or. Alright, and I think that's it. So yeah, if you have any questions, I'll be right outside, alright? Yep. So I'm just gonna lower the bed, put the handrails up, give you the call light, alright, and open the curtain, wash my hands. Alright, so I'll be right outside documenting, okay? Alrighty.